It's of somewhat somber circumstance that we're called together at this moment. But suffice it to say that the health and safety of every single citizen of our state is of paramount importance to us all. And that has been on full display over the last few weeks. And so it saddens me to announce that as of earlier this morning, we as a state have lost our first Hoosier to the coronavirus, COVID-19. Janet and I, and on behalf of the entire state of Indiana, want to extend our deepest sympathies and condolences to the family and to their loved ones of the patient who passed away earlier today. While we had hoped, prayed, and worked hard so this painful day would never occur, sadly, we knew it would. Still, sadly, we anticipate that it will again. This just underscores how incredibly important it is and timely that social distancing is the best way at this moment to slow the spread of COVID-19. I want to specifically thank the physicians and the staff at Community Health Network who did everything in their power to care for this patient. And so with that, I'll turn it over to Dr. Ram Yaleti, the Chief Physician Executive at Community, for some additional case details. And then I'd ask Dr. Box to provide an update on testing and community spread. And then I'll ask Dr. Kane to do the same before I return. Dr. Yaleti.
Thank you, Governor. Yeah, it is not what I want to be talking about today, but want to explain how real this is for all of us. This individual fits into the high-risk categories of being over age 60 and having health issues. The problem is that this individual would not have died if it was not for the COVID-19 infection. What makes this really hard is that this individual's significant other was also infected, and so the two of them could not be together when this patient passed. We had to do iPad conferencing so the two individuals could see each other. So that this individual would not die alone, one of our nurses stayed in the room with this patient. So the one message that we need to take home for all of you is this is the beginning and this is real. People, if you're above age 60, if you have diabetes, cancer, heart condition, lung condition, or hypertension, I urge you to self-quarantine yourself for the next several days to several weeks. Individuals that are young, college kids, all of you are saying, well, it's not going to affect me. You're not going to get sick, but you will get somebody else sick. If you go visit your parents or your grandparents or other healthcare workers, they will get sick and they will die. Sadly, again, this is not the first patient and this will not be the last. Also, with this, we've had several of our own healthcare workers who have to be quarantined. This is paramount right now. We will not have enough healthcare workers to take care of all the patients that are going to get sick. So I caution all of you to be careful, and if you could remain cautious and not interact with others, because we cannot afford to have healthcare workers quarantined or sidelined. We don't have enough healthcare workers as this worsens. Additionally, we don't have enough beds. There's too many people getting sick. So over the weekend, we've stopped all elective surgeries and cases in all our hospitals. We're trying to open up our surgery centers, operating rooms, and other facilities so we could handle more patients. We're going to be using the ventilators or breathing machines that we normally use in the ORs to take care of these patients. And so we're doing everything we can, but I'm still concerned that in the next couple of weeks, all the hospitals in the state won't have enough beds or enough ICU capabilities. So we're doing everything we can, but the best way you could help us is to self-quarantine yourself, minimize the social distancing is not just a fad, it's real. That is the one way we could help prevent further spread of this disease. That's the only way we could prevent it. We have no treatment, we have no vaccine. So it's paramount that we do everything we can to minimize interaction with others and keep that social distancing apart. That's the only way we could try to prevent this from happening worse. And honestly, it's going to happen to more loved ones, and so let's do what we can. Thank you.
First of all, I want to echo Governor Holcomb and Dr. Yoletti's sadness at the loss of our first Hoosier from COVID-19. The news today confirms the shift that we have been seeing in cases of COVID-19 across the state of Indiana. Here in Marion County, it is clear that we're seeing community spread of the novel coronavirus. The cases that we have seen recently cannot be traced back to someone who traveled to Italy or to China, or a particular conference that someone attended, or being in close contact with a positive case. We expect to see more of this across the state of Indiana in the coming days and weeks. This is why it is absolutely imperative that Hoosiers follow the governor's guidance. Stay home, please. Avoid gatherings of over 50 people, but mostly stay home. I know that this makes significant inconveniences in Hoosiers' lives, and we're not used to that. But this is what you can do to protect this vulnerable population that will end up in Dr. Yoletti's ICUs or other ICUs across the state, so that we can protect other Hoosier families from experiencing the same type of loss. We understand that access to testing is a big concern for Hoosiers, and I want you to know there is no greater concern or greater priority for the Indiana State Department of Health than that. We are working diligently to address these concerns. ISDH did receive more kits at the end of last week, and we are expecting more this week. LabCorp is up and testing in the state of Indiana, and they are sending their results to us. I want to emphasize, though, that most people have mild symptoms, and they should stay home, and they should contain their illness in their homes and isolate themselves from other people in their homes so they don't spread it within their families. But unless you become ill enough to go to the hospital, not everyone needs to be tested. We prioritize our highest risk individuals that live in long-term care facilities, individuals that work in long-term care facilities, healthcare providers, not because we think they're of more importance, but because if we test them and they have influenza, they can go back to work 48 hours after their illness is done. But if they have COVID-19, they need to stay home for 2 weeks. And lastly, I want to recognize the amazing compassion and expertise that the healthcare providers not only engaged with this patient's care, but with other patients' care across the state are producing every day. They're our heroes, and they need our support. Thank you.
So my thanks to Governor Holcomb for the invitation to help update the community today. And I will echo what both the governor and our health commissioner, that I'm incredibly saddened by this loss of life. And my heart goes out to anyone who have lost someone today. The Marion County Public Health Department and Mayor Hotsett have been working tirelessly to take the drastic steps needed to protect the citizens of Marion County. Today, the mayor and I announced restrictions for the community in line with the governor's recommendations that aim to create social distance and mitigate the spread of COVID-19. I cannot stress enough how important it is for residents to practice social distancing. Stay home as much as possible, and please wash those hands frequently. Now is not the time to hoard resources or panic. Now is the time for our community to learn how to work together to curb the spread of the virus. We're all in this together, and only together can we minimize the impact of this crisis in our community? Take care of our vulnerable neighbor. Reach out to your elderly neighbor and ensure those around you know how to access resources that they may need, such as hunger relief. So I applaud the governors and Mayor Hotstead's bold actions and all that the state and the city of Indianapolis is doing to provide support to our residents and be able to keep them healthy during these difficult times.
Thank you, Dr. Kane. Let me just add a few comments, and then I'll ask Superintendent Dr. Jennifer McCormick to share a few thoughts, and then Director Steve Cox at Homeland Security to share a few thoughts as well. Earlier today, you should have been in receipt of some additional guidelines that we put out, recommendations. We raised the EOC level to 1. Dr. Cox is with his team and that task force manning our Emergency Operations Center 24/7. We have lowered the threshold or the number of gatherings to 50 from the previous 250. This is aligned with the guidance from the CDC. We're continuing to work with the Department of Education and our schools. We have 273 schools who have already are on spring break or gone to e-learning, but we've got 16 more, and Dr. McCormick, you might speak to that if you would, in terms of being closed down at the moment. We've directed all bars, restaurants, nightclubs throughout the state of Indiana to close their in-establishment dining option, going to a take-home or to-go approach. We have, as you heard Dr. Uletti mention, we have recommended all hospitals and surgical centers to put off all non-elective procedures at the moment in preparation for any surge that may come, and we anticipate that it will. We have directed all state employees who can work from home to do so, and those accommodations are being worked out agency by agency, department by department. We have closed the Indiana State Museum, the White River State Park. We have postponed our Global Economic Summit that was scheduled to be held later in April. And we will continue on an hourly and daily basis look for updates on how to respond. I do want to underscore or echo what has been said already by Dr. Box and others about how appreciative we all have been to have received offers of help from the philanthropic community, from the business sector, from local governments, mayors throughout the state of Indiana, on a constant basis, citizens asking, what can we do to help? This is going to go a long way as we all come together. But just know that we are here at the state and city by city, town by town, everything that we're doing now 24/7 is centered around education, communication, and supplies, and making sure that we're getting the word out to citizens wherever they may find themselves throughout the state of Indiana. To those who think that we may be overreacting, I can assure you that we are not. Indiana is under a public health emergency, and we are, make no mistake about it, at war with COVID-19, and we will win this war, which requires us on a daily, if not hourly basis, to be nimble enough, agile enough to update our battle plan. And when I say us, I mean all of us, each doing their part. As Dr. Uletti, as Dr. Box, as Dr. Kane all mentioned, that has to do with social distancing. It's maybe the single best thing that you could do wherever you find yourself throughout the state of Indiana. That means increasing your own personal hygiene standards. That means checking in on neighbors, not knocking on their door, not going in their house, but checking in on your neighbors. This is the Hoosier way after all. It should come as a second nature. But make no mistake about it, collectively, the actions that we are taking today are going to have an impact, and we think a positive impact, not adverse impact, on what happens 30, 60, 90 days from now. So just know that this team that's been assembled here today, including that goes far beyond that, mayors throughout the state, county commissioners throughout the state, all those healthcare professionals, whether EMS or the physician, the attending physician, we are all committed and fiercely resolved to seeing our way through these unprecedented times. With that, before we open it up for questions, I would ask if Superintendent Jennifer McCormick, if you could share some words, and then followed by Director Steve Cox.
So good afternoon. I first of all would like to thank everyone who is up here. It has truly been a group effort and a collaborative type of spirit, the way this has been approached, and we do appreciate that. I also would like to thank the superintendents across the state of Indiana, our school health care providers, also our technology directors, our support staff, our teachers, their parents, and our students. It is a very, very difficult time. We understand this is about the well-being of students. The safety and security of our students has always got to be our priority, and I will assure you it is. I will also tell you we know we are well aware schools are heavy academics. But right now we also are well aware we are more than that. We are about the whole child, and that means meals, it means support services, there are a lot of things, daycare, a lot of issues that are playing into this that your superintendents and your school administrators are trying to consider and find solutions. Be assured we are not doing this alone. There are a lot of partners, many of them here, but also across communities who are trying to find solutions. Right now we have 273 districts, as Governor Holcomb mentioned, that are closed. We have another 16, and of those 16, many of them had signaled they're on spring break, and they will be making announcements eventually. We also are in communication with the charter schools. Right now we have about 95% of our charters that have announced closures. Our non-pubs, we've also been in contact with our private schools. Right now we have about 70% that we know of that have also closed. And when I say closed, that means close their doors, no instruction, or they're running e-learning day, or a combination of closure and e-learning days is really vastly what's happening across the state. Many of our districts are trying to provide meal services. What does that look like? We've received a waiver. We've been working diligently to get this waiver. That means that our districts, no matter what that threshold for free and reduced students, we found a mechanism to provide food for everyone during this time and trying to figure out the best way to distribute that food. We are still not perfect by all means, but please be assured that we're trying to find solutions. Daycare. We are receiving an enormous amount of questions. We know it is a hardship for families. We are well aware of that. We do not close down school or provide e-learning without being cognizant of the economic and the hardship that provides to families. So again, it is difficult, given the situation, to find solutions, but your schools are trying to address that. So again, thank you to Governor Holcomb and everyone here, but to our superintendents who are working tirelessly out in the field, thank you. I am indebted to you.
Good afternoon. I'd like to offer my condolences as well to the family and friends of the patient that lost his life today. I'm here to speak to the Level 1 activation of the State Emergency Operations Center. Level 1 activation denotes the highest level of activation for the State Emergency Operations Center, denoting full emergency conditions exist within the state. In this instance, the governor is directly involved in the response, operations, and planning that take place in the EOC in response to the COVID-19 emergency. And relative to the COVID-19 emergency, the Indiana EOC is fully operational with some select emergency support functions that are available virtually and can be activated immediately to respond in person to the EOC if necessary. I'd also like to thank all emergency response personnel in the state of Indiana, the first responders that are out there on the front lines doing their job 24 hours a day. They truly are out there on the front lines, and as Dr. Box mentioned about the hospital workers, those first responders, law enforcement, EMS, fire, they also are heroes and are out there and must be acknowledged. So thank you.
Any questions?
Governor, what are we doing for those workers, those employees that maybe forced to take off from work or not go to work with things like NBA, possibly 8500? What is the Department of Workforce Development doing for those thousands of employees here in Indianapolis and across the country?
Yeah, well, the state of Indiana is going to make available through the Department of Workforce Development more flexibility, whether it has to do with showing up in person at a Work One center to request unemployment insurance benefits, waiving any requirement that may be a barrier currently right now. But we're also in close communication, and the Lieutenant Governor and I were on a conference call today with the President and the Vice President of the United States, talking about not just the human cost of this, but the economic cost of this and how it is hitting the full spectrum, both from Main Street to Wall Street. And this goes all the way down to that worker that you just talked about, whether it's a concessionaire or an hourly worker. So everything is on the table. Our whole administration obviously is looking for ways that we can connect with that individual that finds themselves in that specific circumstance of hardship. And we will make sure that we are doing everything in our power to bridge the gap as long as this lasts.
Governor, talk about your teamwork, how you can have enough confidence there were enough beds. How much confidence do you have that the medical facilities of the state of Indiana have enough capacity and employees to reach a potential surge?
Currently, right now, no one here has a crystal ball. And currently, right now, we have the beds. This is one of the reasons why we went to the elective procedures, changing that standard, and why we are trying to make room for increased traffic in our hospitals to fill those beds. In addition to that, we are contemplating, as I mentioned, this is a 30, 60, 90-day outlook, and we have some contingency plans out there should we find ourselves in that situation to accommodate that increased traffic.
Governor, talk about your decision on teamwork. You talk about the team around you, how you come to a decision. Everybody on social media is an expert now on closing everything down and all these things, but how do you come to a decision to close down bars and ask them to do that?
Well, everything that every final decision that's made is inspired by the facts on the ground and the data that comes into each of these respective areas of expertise. We are, of course, driven by medical consultation in every decision that we've made thus far. That is, as I said, it's not rhetorical. That is of paramount importance. That's where we start. The human cost that this COVID-19 is, the toll that it's taking on our citizens and across the country. Beyond that, we are aware of the economic hardships that this is causing. And I can just say, the more we do now, the better, for lack of a better phrase, the better we'll be down the line. And so we will respond to the facts on the ground and be courageous enough to make the decisions that need to be made. Obviously, as you look around the world, as you look around the country, this is crested and even peaked in some areas. We want to stay, relatively speaking, as ahead of the game as we can. And we're doing just that in a very balanced approach, considering the schools, our children, the superintendents, the hospitals, every stakeholder, how these directives are going to impact their daily life. Yes, Kevin.
Some states are looking at maybe using the Army Corps of Engineers to build makeshift hospitals just to make sure that they don't encounter a problem later on when it's too late.
Yeah, Brigadier General Dale Lyles is here for a reason. He has been fully integrated into this task force at a senior level. He's part of the senior team of the task force. These are part of our longer term, and when I say longer term, I'm talking not a month from now, but should we get to that position, again, every resource, every tool that we have at our disposal, whether it's now or what we're requesting from the federal government, is on the table. Yes, ma'am.
Governor, when will the restaurant closure go into effect?
We've put the directive out today, so I would be not asking, directing restaurants throughout the state of Indiana to be winding down today. Tomorrow will change.
What sort of penalties do you plan? Are there any penalties for
Yeah, we're trying to, right now, what I'm most optimistic about as I look forward in this time of stormy weather are the number of folks who have stepped forward saying, what can I do? I know this is going to adversely impact my bottom line, but I want to get through this as fast as we can, so what can I do? Of course, there are going to be resources that come in and around folks who have experienced extreme hardship, whether that's personally or as a business. That's why everything we're doing today, social distancing, self or directed isolation, as extreme as those measures may seem, are effective. We know that from experience around the world. So that's why we're going to put out guidelines on a daily or hourly basis. We are all meeting early in the morning and late at night on a day in, day out basis. That Emergency Operations Center is open 24/7. It's not just the lights are on, people are staffing it for this very reason, to be able to respond appropriately. Nikki, you had a question?
Oh, I had a question for Dr. Fox. Could you tell us, A, if we've had any patients who have actually recovered fully yet, and also whether you have got any of the Roche tests that were made available?
First of all, yes, we have had some individuals that are in the process of recovering, not completely out of isolation at this point in time. And to my knowledge, we have not received any of the Roche testing kits.
Dr. Fox, what about resources for rural health departments who may not even have epidemiologists or funding to really go after this aggressively?
So the Indiana State Department of Health, with every positive case, is meeting with, talking with local health officers and their healthcare coalitions in that county. And we are offering to stand in the gap for any health department that needs assistance.
Dr. Fox, do you know anything about the interactions of the victim who's passed away, where they've been? You need to tell me where she's been?
There are not any direct, I mean, she'd been around the Midwest area. There was no direct, I've been to Italy or I was in Seattle or anything like that.
Dr. Fox, if someone comes in thinking they have symptoms, what would be the reasons you would not test them? Is that a concern?
I didn't hear the last part of the question, I'm sorry.
If someone comes in thinking they have it, why would you not test them? And is that concerning to people?
Right, it is. It creates a lot of anxiety. Even people who are well want to get tested, and I understand that. But the reality is, you could have minimal symptoms today and be tested and be negative, and 2 days from now be positive for COVID-19. So that gives you a false sense of security. So what we really need to do is test those people that are coming into our hospital emergency rooms who are sick enough to either be admitted or considered for admission, who have underlying health conditions, who may, as I say, work in long-term care facilities, live in long-term care facilities, be healthcare providers, those individuals that are working with our most vulnerable population, and then to know in our hospitals, those people that are in ICUs, who's positive for COVID-19 so that we can make sure that we are protecting our healthcare providers. I think as Dr. Yoletti mentioned to you, they have like 40 people that were exposed by one person in their healthcare system. And that is simply because it was not expected in this patient. And so realistically, we cannot afford that across the state of Indiana. We don't have that many healthcare professionals. So we have to be protecting and being very careful about who we're testing. Now, pretty much anybody can get tested if they want to go through the LabCorp and their primary care provider feels comfortable doing that testing. There's a delay in that testing result, but again, I do not recommend that because that 80% of people that have those mild symptoms should just stay home and get better and not really use those resources of the personal protective equipment and all the other things, even viral media, viral swabs that are so critical at this time.
Dr. Fox, let's talk about people with pets. You talked about family. Sometimes pets are the most caring companion. When you tell the people with pets out there, dogs and cats, that to take care of them?
Well, to take care of them because you're worried that pets have COVID-19, or because, I'm not sure about the question.
Well, just about being around them and having their pets around other people.
Right, so we know that pets can carry this, but my understanding from talking with our lead veterinarian is that they don't pass this to individuals, to patients. So again, I think for other reasons, it's probably good to not let your dog lick all over your face and to wash your hands after you've been handling your dog or cat.
How about the jail systems in the state? Is there a risk of transmission? Staff there can't really work from home.
Yes. So a part of our assembly of agency heads includes our Department of Corrections and our jail system. And we have them represented and are meeting with them twice a day and discussing this, because we know that that's another area where we will have some vulnerable population that if that gets loose in a penitentiary or gets loose in a jail could cause a lot of individuals to get sick.
Can you talk about how many ventilators there are in the state, and at this point, how many of the 24, I believe it's been longer, but of the patients who currently have COVID-19 are hospitalized? I see it.
I can't give you an accurate number on that. I'm sorry, I'm not sure. I will say that at this point, even with the flu season that we've had, we are not experiencing a shortage of ICU beds or ventilators. And we do have constant contact with our hospital systems to know that. There are a lot of older ventilators out there that we can repurpose. I know that in my missions trips to Haiti and Bolivia, I've oftentimes gone and asked for their old ventilators and taken them down so we could do surgeries.
We're talking about the 2018 platform that we put in effect with the hospital.
So we do, the governor's mentioning a 2018 platform that we invested in 2018. It's called EM Resource. It connects all of our hospitals, all of our long-term care facilities, all of our dialysis units, all of our EMS, all of our local health departments on the same platform. So it is daily updated, and it gives us a picture of what the state of Indiana looks like.
Governor, Indiana has a lot of legions, a lot of DFWs, a lot of those private club organizations. Obviously, your order goes to bars, restaurants, nightclubs. What about those folks that may not necessarily be a bar or restaurant, but they're still a gathering place, particularly with maybe some folks who may be more susceptible to the...
Yeah, I'm a member of one, or more than one. They are us. And so we would ask they follow the same guidelines that every other Hoosier has to follow. That means a gathering of under 50, and to practice social distancing while you're there.
Mayor Hunt said issued an order today that went beyond bars and restaurants, movie theaters, fitness facilities, things like that.
Yep.
Are you prepared to spread that statewide?
I am if the facts on the ground warrant it. Yeah, Mayor Hogsett took decisive action today because of the community spread. And if another county finds themselves in the same situation as the mayor found himself in, they should and we will assist on making the right decision.
A lot of your guidance is basically through the end of March right now.
Yeah.
Should Hoosiers reasonably expect for things like these closures to last well into April and maybe even beyond?
Yes. I think Hoosiers should expect to stay both informed and prepared for this to last as long as it does. And that means 30, 60, 90 days. Why not mandate? Because of the hardship and the ripple effect that it would have on just ripping that Band-Aid off in one fell swoop. We want to, as Dr. McCormick just articulated, we want to make sure that we're working with schools in terms of meals, in terms of transportation, and in terms of daycare. That has rightfully caused us to be reaching out to different philanthropic organizations throughout the state that can assist us, whether it be YMCAs, YWCAs, Boys and Girls Clubs. So this is causing us, this is a silver lining, by the way, this is causing us to all work together. And to have just said, do it tomorrow, would not take into account properly the facts on the ground and the hardships parents and their students would have had to go through. And by the way, this was informed by the superintendent of the Department of Education and the superintendents around the state of Indiana.
Governor, are you considering dipping into the state's monetary surplus? You had mentioned
Yeah.
it's for a rainy day. It feels like the middle of the storm. Are you going to reach?
Yeah, it's torrential. Yes, if need be.
Do you have any estimate on how much you expect tax revenues to fall due to the loss of business?
We'll report, we'll be very transparent about that, Nikki. Secretary Schellinger is part of the team as well, and Chris Johnston obviously will reporting on what impact it's having on our budget and what impact it's having on our business attraction on a month-by-month basis, at the most month-by-month basis. But this is going to be a big hit. What we're trying to do is flatten that curve, slow the spread so that it doesn't last as long.
Could you explain, Governor, just for folks who may not understand, the legal authority that the state uses to do exactly what it's doing when it comes to closures and...
We have a constitution and we'll follow it. Was your question the percentage of beds when we start to get worried? What?
That's part one. Part two is what are the contingency plans?
Well, the contingency plans longer term will be just that. We'll get into those details, and I suspect if we get there, Brigadier General Dale Lyles will provide further detail. But we have resources, we have assets around the state of Indiana to be able to accommodate a surge. We're not there yet, so I won't speculate on specifics. With respect to the beds, you want to talk about a threshold that would cause you concern?
I think that one of the ideal things about EM Resource is it allows us to look at hospital systems separate from the entire state. It allows us to look at regions separate from the entire state, so that as we look at one hospital area, one region being really full, we can look at other hospitals in that same region that will be able to accept those patients. And then we do have, as the governor's mentioned, contingency plans.
Can I just say one more thing? Sorry. I think I was getting ready to get the hook here. Let me just, I see Speaker Houston and Senator Alting and Representative Klinker here. We are in direct contact with members of the legislature, with our statewide, with our mayors, with our county commissioners, with our federal partners, and we'll continue to do that. Later today, I'll be in communication with our congressional delegation. And these conversations, these updates will be perpetual. And you can look for more updates, and I want to make available, whether it's got to do with a constitutional question or economic question or a public health or safety question. We want to answer every single question you have. And I mean it when I say it. We appreciate you getting the facts out to the public at large. This is a time of heightened anxiety and concern. That it needs to be. Folks need to take extra precautions that they may not have ever envisioned before. Now is the time to take those extra steps. Thank you.